Hi, I'm Dr. Rob Endicott of the Quayside Dental Practice, and I just wanted to talk to you today about gaps. Gaps in your teeth. Very common problem that we come across. I probably don't need to tell you this, but one of the first things that people notice when you meet them for the first time are their eyes and their teeth. And obviously, if you've got a gap between your front teeth, it's not the most glamorous thing in the world. Fortunately, these days there are quite a few ways we can actually fill that gap to suit many different budgets. I'll tell you straight off that the ultimate way, the best way that we can actually fill a gap is to use a dental implant. A dental implant is basically a titanium root. It's like a raw plug that you put in where the tooth used to be, and then you can screw into that a crown, a bridge. You can use it to make a denture feel rock solid. You can do all sorts of things with it. But say for a single front tooth, you can put an implant in and then just put a crown on the top. They look absolutely gorgeous. They last for donkey's years, and we personally guarantee ours for 10 years. But they just go on and on and on and on. With regular maintenance, they are absolutely fantastic, and you don't have to do anything else with the teeth either side. So they're very, very kind to the mouth. One of the first things that people say to me when I talk about implants is they say, oh gosh, aren't they horrendously expensive? They are the most expensive thing that we can do. But long term, because you're not having to replace things, you're not having to damage other teeth, they can actually prove to be very cost effective. And these days with modern payment plans, we can actually split up the cost into more manageable chunks, say over 10 months or 2 years or 3 years or whatever. The second option is to go for a bridge. Now, a bridge basically is something that's made in a laboratory, and it uses the two teeth either side for support, and then there's a false tooth in the middle. Bridges are fantastic. They look absolutely great. Like implants, they look absolutely gorgeous. And they last for years. I mean, I guarantee all my bridges for 5 years, and we expect them to just keep going. I think the average lifespan is about 12 to 15 for really good bridges. So, yeah, they should be there for a long time. But the major disadvantage about a lot of bridge work is the fact that you have to do work on the two teeth either side. Now, if those two teeth have already got crowns on them, or if they've got huge fillings, you could actually be doing those teeth a favour. But quite often the teeth either side are actually quite healthy, or they've only got small fillings. So, yeah, it does introduce a risk to those teeth over the long term. One of the things we know is that if we cap a tooth or we bridge a tooth, about 10% of those teeth need to have some root canal work on them at a later stage, within about 5 years or so. So that's something to bear in mind. The third option, which is the cheapest option, is to go for a simple denture. Dentures are removable, so you take them out before you go to bed. Yes, sometimes you have to leave them, in some water overnight. It's not a bad idea. Dentures can look absolutely fantastic, and in fact, your best friend could have a denture and you may never know it. In fact, we know some people whose husbands and wives don't even know that they've got a denture in place. They can be extremely comfortable. You've always got that problem, the psychological problem that dentures are always related to, grannies and leaving it by the side of the bed at night, that sort of thing. But because they are so comfortable these days, it's not necessarily a problem. They are not the most stable thing in the world. They can stay in place quite well, but a lot of people have to use some adhesive to hold it in place, which doesn't taste too great. But if you want an option that actually gives you the confidence of not having something that's going to move around that you can forget about, then the implant is the #1 option, and the bridge is the #2 option. Either way, there is no need to put up with a gap at all. Just give us a call on 01323 472 772, and we'd be delighted to chat it through with you. Thank you very much.